Hi friends, let us start with a case. So a lady of about 28 to 30 years comes to me. She has recently delivered a baby of 5 months old and this lady वो बहुत ही depressed mood में है, बहुत sad है. She comes, sits on the chair and starts weeping. She tells me that I have delivered a baby. She's 5.5 months old, my daughter, and I couldn't feed her because I had a galactorrhea, so I couldn't lactate her. And since then we have not a great bond between us, me and my daughter. And when I was at my mother's place, she wouldn't even sleep with me. She would sleep with my mother. And that would always create an insecurity in me. Also, when I came back to my in-laws, my father-in-law is always with her because I don't have my mother-in-law, and father-in-law is always playing with her. I feel very possessive about her, yet I don't have energy because I have to do breast pumping and night watchings with the child. So I was a bit surprised. I mean, it's very common to have night watchings with a newborn baby, isn't it? But she was feeling it exhaustive, and she told that it is very unmanageable for me that to look after the child, to feed her, to do breast pumping because I don't have milk. Now, all this is creating a great irritability in me, and at times I'm angry at her. At times she's crying, and I don't, I don't go near to her, and I just keep her crying. So then I feel that, oh, I'm a mother, and I should not have done like this, and this is, I'm not a good mother. So that also pricks me, and she started weeping, and she's like very helpless, and asks me what can I do so that I don't feel this burden of doing simple duties for my daughter. I don't get irritated at her. Please give me some medicine. So this was a case, and the rubrics I'll tell you which I had taken. First rubric, which was very simple, delusion poor. She was telling, I have lack of energy. I don't have that much of energy to look after the child, even if I become possessive. Secondly, I took helplessness feeling of. She was feeling completely helpless. She didn't have anybody to help her at her in-laws' place. And then irritability, weakness with irritability, children towards, impatience, children towards, and anxiety, conscience. And the last one, despair, supported, wants to be. So she was in complete despair, and she wanted somebody to help her, somebody to take her out of that situation, somebody to help her restore her relationship with her daughter. So I gave her, with all these rubrics, Bambusa 33 doses, and it gave a wonderful result. Next time she came smiling, and within a short while she could start enjoy her relationship with her daughter. So this Bambusa, obviously, we are going to discuss today. So this is not a very old remedy. This was reproved especially by Dr. Bernd Schuster in 1994 in Germany. So in proving, he said that he has been able to benefit around 100 of patients, and then he has taken three important things which are the focus of Bambusa. The first one is the backache, the hollowness in the back, which could be the doctrine of Bambusa, because bamboo is hollow from inside. As you all might have guessed, that Bambusa is prepared, Bambusa Arundanacea A. It is prepared from shoots of bamboo plant, and so the doctrine could be regarded as that the lady feels very weak in her spine. She feels her spine is hollow. Second is all the hormonal problems, maybe postpartum, that is after the childbirth, or any hormonal problem. That is another focus of Bambusa. And the third one, he has specifically stressed upon the child factor. The child factor is that there are certain unfavorable conditions or the problems about the child, and this lady cannot get along with that child or cannot get along with those problems, and becomes helpless. So this is a scenario, and incidentally I have been able to treat many of my cases with Bambusa. I give you a few examples of my cases. One case I remember that she was a very delicate lady, 45, maybe of 45. She was under AKT, like she was diagnosed of tuberculosis, and the treatment was almost on the verge of getting ended. Yet she had tremendous nausea, and this nausea she would suffer early in the morning, and in the morning she wouldn't be able to cook anything for her husband and her child, I mean her daughter. So she had come to me, and she was telling that I have tremendous weakness. I cannot cook at all, and I just do not cook at all. And then my husband has to manage outside, and my daughter also suffers. And during the conversation, she told me that she has 15 years or 16 years of a daughter who has got Down syndrome, and she keeps on laughing very loudly, and that really disturbs her, this mother. And this mother feels that, gets irritated at her, shouts at her, and then feels very bad that it's not fault of that child who is having Down syndrome, but why she should scold her own child when the child is also doing it unknowingly, and she is not doing it purposely. So she feels, why should I shout at her? That pricks her that I am not a good mother. So again, this focus had come. Another case of mine which I remember was a young girl who was newly married, maybe 3 years back. She was married and she is a lawyer. She was working in some firm, and this boss of her would exploit her, would make her overwork, and wouldn't give money, but she would work over there. And when she came to me with the backache, she told me that I am planning for a child, and I really want to have a child. I'm constantly thinking about when to have a child, what is the right time to have a child, and because we have some loan, I'm just tolerating that exploitation by my boss. Once we get money and once we repay the loan, we are going to take the chance for the baby. So I understood that she was definitely the delusion poor I had taken, and then I understood that she has anxiety about money matters. So this is also one aspect of Bambusa which is very important. And the third thing I understood, that she was completely in the world of the child which is still not born, which is not still conceived also, but she was completely into that child factor. So I had given her Bambusa, and next time she took the decision and delivered a baby. So this was also there. And one of my patients who had a severe allergic rhinitis, and she had come to me, and all I had taken all that delusion persecuted and whatnot. She was constantly telling me in first 2 meetings that that was actually my first case of Bambusa. So she was telling that I cannot get along with my elder son. My younger son is okay, but elder son doesn't have maturity. Like, he doesn't understand certain things, and I get mad at her. So he always says, "आप इतनी hyper क्यों हो रही हो माँ? मेरे साथ ही ऐसे क्यों करते हो?" तो मुझे बहुत बुरा लगता है कि अरे 2 मेरे बच्चे हैं, तो एक बच्चे के साथ तो मैं अच्छा बिहेव करती हूँ, लेकिन दूसरे बच्चे से मैं कुछ बात भी नहीं कर सकती, इतना उस पर चिल्लाती हूँ, इतना उसको डांटती हूँ, तो दोनों तो मेरे ही बच्चे हैं. So this was that anxiety conscience, that was breaking of the conscience that I picked, and impatience children towards. And I had given Bambusa, and allergic rhinitis had disappeared. So let it be postpartum problems, let it be backache, let it be allergic rhinitis. When there is a child factor, I understood, which with which the mother is bothered and she cannot help it, especially the helplessness, the irritability towards child, and the pricking of the conscience. These three things, when they come together, that makes Bambusa. So Bambusa, if we see the personality, it again goes to the doctrine. It's the doctrine is the upright bamboo shoots. They are not flexible like cane, so it's quite a fastidious personality, and usually wants her things to be done in her own way. But because of some problem like postpartum problem or because of some child factor, when she lands up into such unfavorable circumstances, her weakness or her inborn tiredness comes up. In Bambusa, if you see, weakness is a word which is used specially for Bambusa in the repertory. It's not metaphorical like delusion poor, but weakness is something which is lacking, which is a fault, which is inefficiency, not insufficiency. So what happens is in Bambusa, when she lands up in such a case, her inborn weakness comes up and she becomes helpless, helplessly irritable. She becomes totally inefficient in her household duties. And because she is an upright personality, there is some conscience in her. So that pricks her. So she gets irritable with the children, she gets irritable with the child, she gets irritable with the weakness also, and then inefficiency that she neglects all her household things. So there are certain rubrics which are aversion to the household duties. Household duties towards household duties she gets aversion to. Cares, aversion to the cares. Then responsibility, aversion to. So all these rubrics show us that she becomes really inefficient and doesn't look after her loved ones or her household duties. But being an upright personality, she has that conscience, and that conscience keeps on pricking her that yes, you are not a good mother, you are not a good caretaker, you are not a good housemaker. And this makes her more irritable, more sad, more depressed. And in this situation, she comes to us for support and light. Delusion, supported, desires to be. Confidence, lack of confidence, support, desire. Despair, supported, wants to be. So all these rubrics will show that at this point where she is irritable with her weakness, where she cannot manage her child, she becomes helpless, she keeps on becoming impatient at the child, and in spite of that there is a pricking conscience that I am not a good mother, why I am getting so angry with my child, unreasonably angry. And this pricks her with all this situation. When she comes to us, she's Bambusa, and we need to give her that support and light by giving her a few Bambusa doses. It's just a situational remedy. You give Bambusa and the phase is gone. Like it's magical. But at this phase, she most of the times she presents like sepia, like delusion poor, and anxiety about children. We can take impatience and as anxiety sometimes mistaken, and then we give sepia. But if you see sepia, in sepia she is a nux, which is nux as a housewife, that she enjoys doing all her duties. When she becomes insufficient to do this, then she feels poor, and then when it goes beyond her threshold, she will go into indifference, and indifference lies with eyes closed, that she close her eyes to all the things which are her duties. But in case of Bambusa, Bambusa doesn't go in indifference because she has that conscience of mind And so she comes to the clinic for support and light. And at this point, if we don't give her support by giving Bambusa, she's definitely going to land into profound depression, delusion cut off from life, delusion something presses on soul. So all these rubrics represent the profound depression in Bambusa. So we need to identify at the right time uh, her inborn weakness, her involvement with the child, her impatience with the child, her pricking of conscience, and her desire for the support and light. And that is Bambusa. Thank you so much.